as a dentist, dental hygienist, how you could be a better ally to this community. So again, I am currently working at Legacy Community Health Center in Houston. Legacy is a federally qualified health center, and historically this clinic began in the 1980s, primarily in response to the AIDS epidemic during the time. And so the original location of this clinic was, originally called the Montrose Clinic. Montrose is the LGBTQ neighborhood in Houston. And over the years, this clinic grew and grew and grew, and now is the largest health center in Texas. And I'm also one of the founding members and current president of the Houston Equality Dental Network. That is our group from one of our gatherings a while back. And the Houston Equality Dental Network was created in late 2019, kind of in response to having a community of strong-minded dentists in the Houston area who wanted to get involved, who wanted to do more, who wanted to network, but never truly felt that they can be themselves in the professional networking settings that were offered to us. So what first started as a social organization quickly grew. We quickly realized that there were a lot of people in the greater Houston area who identified as LGBTQ and wanted to act professionally as an organization, wanted to not only advocate for who they are, but advocate for the patients as well. And since then, we've spoken at the dental school at different events. We've had a bunch of different social events, volunteering events, educational PE courses as well, just like the one that we're doing today. And the objectives today are to increase your overall awareness and understanding of the LGBTQIA community, to recognize some common terms, to talk about and start to study and inspect the health disparities faced by the gay community, and to learn about the medical, the emotional, physical changes that transgender individuals go through so that you can better care for these people. And of course, examine ways to be a better ally dental professional. So I always like to start off this presentation by discussing that at its core, nature is diverse. Biology is diverse. And I always use this example. There are thousands of species of gender fluid animals known to man. Just in fish, right? There are at least 500 different species of fish that experience this gender fluidity throughout their life. A lot of this will happen based on population levels. For example, if there's a head male that dies, the next kind of head female or older female will change its gender to become male. This happens a lot also to control the population levels as well with certain species of fish. So when I learned about this, I thought this was really interesting of how, gender in a species that we don't really think about is so fluid and changes so often. And continuing on with having diversity in biology, there's something that some of us may know called DSD, or differences in sex development. It's a group of rare conditions involving our chromosomes that end up, having a different combination of chromosomes that we would normally expect to have as far as XY chromosomes versus XX chromosomes. There's oftentimes a rarity that occurs where individuals are born with a different genetic makeup with their sex chromosomes. That's also we know to be as intersex. And this differences in sex development, it means that a person's sex development is different than most other people's, or different than what we would expect it to be based on their genes. And there are different categories. Because of the sake of time, I will be kind of skipping on some more of the details, like this page. But at the end of the presentation, I'm going to be offering my email address, so I could definitely share a lot of the more details that are on this presentation as well. So some examples that we might have learned about in dental school and hygiene school or before undergrad, we have Turner syndrome, which is when females are born missing the second X chromosome, as well as Klinefelter syndrome is when males are born with an extra sex chromosome. And overall, a little less than 2% of the population is intersex. I'm estimating this percentage to be a little bit higher by now. A lot of this just went unrecorded for so much history. It's not until really now that we're, as a population, understanding what it means to be intersex a lot more. And, we talk about gender being a spectrum a lot, and much like that, our physical sex characteristics are also a spectrum. And again, because it's very dependent on the combination of chromosomes and hormones that an individual may have. So because of that, physical bodies we know will be different. Just like gender is a spectrum, so are physical sex characteristics. And around the world, continuing on with the fluidity in biology, fluidity in nature, has always been gender fluidity in different cultures, especially a lot of non-Western traditions and communities all over Asia, all over South and Latin America, really all over the world. An example that I always like to share are the Muche of Mexico. And this is actually a recognized third gender among the Zapotec people in Oaxaca. And this is a group, a community that is praised and that has been worshipped for so long before colonization, right? These are things that have been celebrated. Much like the Hirja in India, Hirja refers to a third gender of several South Asian nations. And just like the Muche in Mexico, for a long time, the Hirja was India's third gender. But unfortunately, as India was fractured by colonization, was to the Hirja community. And for a long time, these Hirjas occupied a space in the religious community and, were there for special religious events, for holidays, for weddings, ceremonies. And it's really unfortunate now the way the world and society has turned that this community is targeted and this community is all of a sudden criminalized, right? So it's just very interesting to think about our past as human history. So I'm going to go over a few terms and definitions. Now, a lot of this is going to seem really simple, really rudimentary. But, I teach and I lecture to all sorts of people, dentists maybe that have been in practice for decades and don't really know anyone well that is gay or transgender. So a lot of this is new to a lot of people, but for a lot of us today, this may be pretty common sense. So I oftentimes do try to use the full acronym, right? The LGBTQIA+. And I know it seems like this is growing every day, and that's because it kind of is. That's because we're realizing how to pay respect to all sorts of people, all genders, of all orientations. And because of this, for the rest of the presentation, I will be using this word. So the word queer is a word that I like. It's a word that I use to describe the LGBTQ community and a word that I use to describe myself. At the same time, it's important to consider that this is a word that may hold a lot of tension and a lot of trauma to some people as well. People that are older in the LGBTQ population may not enjoy using this word because it was often for a very long time used as a slur. Now it seems like the gay community is taking back this term. And so for the rest of this presentation, I will be using this word because to me, it's an umbrella term. It's really everyone that falls in this gender or sexual orientation spectrum. So I always like to distinguish between gender and sexuality because these are two very different things. So with these three blocks, gender identity, that is someone's perception of their own gender. What you perceive your gender to be based on how much you do align or do not align with what you understand or what society tells you that gender is. Aside from that, we have gender expression. That's the external display of your gender. So this can be done, through a combination of grooming, of clothing, social behavior, demeanor, and any other factors. And then we have sexual orientation, and this is an individual's attraction to members of either the same or another sex. So this is what we know to be as lesbian, gay, etc. And so these are all very different things. And it's important to understand that all these different things can all come as a spectrum at different levels. And everyone really falls on the spectrum with all three of these. So to give some examples, someone may have that internal identity of being a male. That's their gender identity. They may dress in what we know to be mostly traditionally masculine clothing, say a suit, say jeans, right? That is their gender expression. and their sexual orientation may be bisexual. So these can all be interchanged, right? As far as gender expression goes, affirming your gender means presenting in a way that's comfortable for you. We learn a lot when we'll talk a little bit more about this when we talk about the transgender identity and the transgender community. There are a lot of attacks on the transgender community right now, and a lot of those attacks are people who don't like people affirming their gender. But when we think about that, isn't getting a haircut regularly as a man because you like the way it makes your hair look or makes you feel, that's affirming your gender. Grooming a certain part of your hair or body, that's an expression of your gender. And so I just want us to start thinking about all the ways that, maybe you individually affirm your gender. And again, kind of just another example. For this example, the person may identify as male, but their gender expression, they may wear things that you think to be traditionally more feminine, like a skirt, maybe wear makeup, maybe have high heels, long hair. Just because they express their gender that way doesn't change their gender identity. These are two very different things. And again, kind of just skipping over a few things. These are, again, some of the basic terms, which I think here we are all familiar with. So I'm going to skip over some more of the basic ones just for the sake of time. Now, some other terms that maybe are new to a lot of us. So pansexual, that's a person who experiences attraction to members of all gender identities and expressions. A way that this is different than bisexuality is that the term pansexual addresses the fact that there are more than two genders and that there are many gender identities. So someone who identifies as pansexual will have attraction to a cisgender male, a transgender male, cisgender woman, transgender woman, and anything in between. To be demisexual, that is a term that means that someone is only sexually attracted to a person when they have an emotional bond with that person. To be asexual is experiencing little or no sexual attraction to others. Just because someone is asexual, that too falls in a spectrum. And this is a real thing. This is a true thing. Someone who is asexual doesn't mean that they don't have any relationships, that they don't have intimacy, or even that they don't have sex. But again, this is something that comes in a spectrum. And then queer, we talked about that. We use it as an umbrella term to describe individuals pretty much who don't identify as straight. And again, due to its historical use as a derogatory term, some people may still not fully embrace this term. But again, for the purpose of this presentation, queer is going to be used interchangeably with LGBTQIA. Your biological sex is a medical term used to refer to your chromosomal, hormonal, and anatomical characteristics that are used to identify a person either as male or female or intersex. And now to be transgender is a description for someone who has transitioned or is transitioning from living as one gender to another. We talked about intersex, and we might hear a lot the term non-binary now. And again, this is also another umbrella term. This is really someone who maybe not really fully consider themselves as transgender, but may not see themselves fully embraced by either male or female identities. So having the identity as non-binary or genderqueer is something that a lot of people are really understanding nowadays. Offensive versus preferred terms. So, some of these may not really per se be offensive, but are just a little bit outdated. And the fact that they're outdated makes them offensive, right? Like a homosexual. It's just strange to ask someone if they're a homosexual. Easily use the word gay. You can use the word lesbian, right? These are the words that are underlined are preferred. They're okay to use. They're safe to use. Sexual preference versus sexual orientation. Again, this is something that has evolved. Just as language evolves, these terms will evolve as well. And so it's safer and better to use the term sexual orientation when asking someone, when describing something. Same thing, we don't want special rights, we want equal rights, just as every other human deserves. An important one to know, never use the term sex reassignment surgery when referring to transgender individuals. We use gender affirming surgery, right? Because we are affirming the gender that they feel they are within their gender identity. Same thing with preferred name versus correct name. It's not a preference, it is who they are, right? So their correct name, this again is in regards to transgender individuals who may have changed their name. It's on a preferred name, it's their correct name. So in the dental setting, that's what you want to ask a patient. That's what you want to leave the option for, a correct name. And now lastly, kind of a newer one that I've added to this presentation, you may have seen the term MSM in a lot of research. This is a term that started in the research world, in response to research on HIV and AIDS, because this was the population who was getting HIV and AIDS. Now, this is a term that is a little bit outdated, right? Because at first, this term was created because not all men who have sex with men identify as gay or identify as bisexual. But now there are people that fall into this category, maybe for research purposes, that don't identify as a man. So this can be a transgender woman who falls into this category, but they don't identify as a man. So, this is something that kind of is a newer topic, but just that kind of something to think about, and you may see change in the research. I am going to skip through a little bit more things, so I want to get into some health disparities. So the reason that health disparities exist in the queer community is because of heteronormativity. It's this assumption that everyone is heterosexual, that heterosexuality is superior, and that is the only way to be. This leads to invisibility. This leads to stigma of other orientations and sexualities. This gender normativity, these gender roles that we've learned for so long, it's the assumption that an individual should identify either as a man or a woman and either be masculine or be feminine, that there was no in between. And this understanding, heteronormativity, this is the cause of homophobia. In 2016, the community was identified as a health disparity population. They realized and discovered that this community really does have less access to healthcare. They have higher burdens of certain diseases, such as anxieties, depression, substance abuse, certain cancers, and HIV and AIDS. Unique health challenges, and there was a huge lack of research at the time, and still is today. Now, in 2020, a survey conducted by the Center for American Progress found that 1 in 4 queer people have reported experiencing some sort of discrimination within their lives. So about 25% have been discriminated. About 10%, 1 in 10 people reported actual medical providers refusing to see them based on their sexual orientation, once they found out, once they realized. About 3 in 10 trans individuals reported providers refusing to see them based on their gender identity. About a third of trans people reported hearing negative comments about themselves at a healthcare facility while they were there. And about 70% of queer people reported that discrimination has somewhat negatively affected their well-being. And now when it comes to these disparities, we see a huge difference between those who identify as either lesbian, gay, or bisexual, and those who identify as transgender. As you can see in these individual charts, those that identify as transgender, their health disparities are much more common. The struggles that they face are much bigger. Many more transgender individuals have been refused medical service based rather than those that identify as LGBT. And so this is something to consider, right? While the queer population as a whole faces so many challenges, transgender individuals face even more. And a lot of this is because of the minority stress theory. It describes that high levels of stress faced by members of multiple stigmatized minority groups will affect their well-being. They have poor social support, lower economic statuses, face prejudice and discrimination. And so those holding multiple marginalized identities experience greater discrimination than those holding a single marginalized identity. So what does that mean? That means that transgender women of color are one of the most marginalized communities in the country right now. This is the community in the nation that is mostly targeted when it comes to murders, when it comes to sexual assault, when it comes to discrimination, abuse. And that's because there are so many things that these people face, that these individuals face. They have so many marginalized identities. when they face transphobia, homophobia, sexism, racism, colorism, and all these things bring all this trauma, all this discrimination, all these burdens within their lives. So, if you can look at this chart, maybe there's, one thing that you may have experienced. Maybe there are two. Maybe there's someone that that have experienced multiple of these. What would it feel like to have all of this going on in your life right now while you're just trying to be who you are? How would you be able to navigate your life? So in the queer community, there are certain health and wellness considerations. There are some behavioral considerations when it comes to increased mental health conditions like depression, like anxiety, medical conditions, substance abuse, certain cancers, sexual considerations, because we know that there's an increase of certain STIs and HIV, and of course, social political considerations. Queer people living in areas that have high anti-LGBTQ prejudice or anti-LGBTQ laws have been known to die sooner, about 12 years sooner than those living in more accepting communities. Again, more details that I'm going to have to skip for the sake of time, but I will share this information later. So with HIV and AIDS, this is something that we have learned a lot about in our schooling. Today, an estimated 1.2 million Americans were living with HIV. And out of those people, only about 87% knew they had HIV. In 2020, about 30,000 people received a new HIV diagnosis in the US. And, overall, new HIV infections have declined about 8% in the US from 2015 to 2019. And in the biggest group, right, among young bisexual and gay men, from 2015 to 2019, rates of new infections have dropped 33% overall. So that's a pretty big deal. That's impressive. We'll discuss why. However, men and transgender women who have sex with men are still the population most affected by HIV in 2019. And like I said, while there's been an overall decrease in new infection, the number of HIV infections for transgender individuals and adolescents has actually increased. So overall, while there's been a decrease, there are certain populations that have an increasing trend. And something that the CDC recommends is that all adults, every single person, regardless of your demographics, regardless of your sexual orientation, every person should be tested at least once for HIV. In 2019, about 65% of those living with HIV were receiving some sort of HIV care. 50% were retained in regular care, and 56% had a viral suppression of the HIV virus or were undetectable. And so having a suppressed or undetectable viral load, it protects this person. It protects them from against progression of the disease. And there's actually a major prevention benefit when it comes to HIV treatment. This is a major reason on why it's so important to get tested and why it's so important to get treated. Because once you're treated, you can have a virally suppressed load and be undetectable. And that is the goal, right? Now, for HIV prevention, some of us might have heard of pre-exposure prophylaxis, or PrEP. PrEP is a medicine that people take who are at risk for any HIV, and they take it to prevent getting HIV from sex or injection drugs. When taken as prescribed, PrEP is highly effective against preventing HIV. Currently, there's 2 oral medications for PrEP. There's Truvada and Descovy, and PrEP reduces the risk of getting HIV from sex by about 99%. So that is incredible. So this is a daily pill, and it is recommended that those who are either in a at-risk community, those that, it's really recommended for young men that are young gay or bisexual men who are sexually active to take daily, as well as any sort of injection drug users. And so there's major prevention in this because this is how we end the epidemic. In 2020, about 24% of people estimated to have PrEP indications are prescribed PrEP. So we really want to see that number grow. Apretude is an injection drug also used for PrEP, and it is injected once every 2 months. So this is different than a daily pill. And this is actually an important tool to end the epidemic, because a lot of the at-risk group may be people who are homeless, maybe people who are incarcerated, people who have, severe mental health considerations, or, people that just cannot physically take an oral pill every day. So because of this, an injection drug once every 2 months makes it easier for these individuals and still gets them the same effects for HIV prevention. So yeah, think about these, remember these names, right? Truvada, Descovy, we see them in a patient's medical history. Know two things, right? Know that these medications are also used for people who have HIV, and it's used as a treatment medication, but they're also used as PrEP. So if you see this in a person's medical history that they're taking this medication, but their medical history does not signify if they're HIV positive, don't assume that they're lying, right? Don't look up this drug and realize that, oh, it's for HIV. This person is lying about not being HIV positive. They could be using it for PrEP, right? It's always safe to ask. About 30 to 80% of HIV positive adults have what are referred to as some sort of HIV related oral abnormalities. So that's, of course, xerostomia, mouth ulcers, more likely to get candidiasis, dental caries, gum disease. And so those living with HIV should have regular dental visits. In dentistry, standard precautions should be followed with all patients regardless of their HIV status. And of course, the occupational source of the greatest risk of HIV transmission is through a needle stick, right? Or it's through some sort of skin injury. It's important to understand that after a needle stick exposure to HIV infected blood, the average risk of actually getting an HIV transmission is about 0.3% per exposure. Okay, so we're going to talk a little bit more in detail about this. So this current rate is, if you get a needle stick exposure from something that had HIV infected blood on it, the risk of actual transmission is only 0.3%. So it's less than 1%. Now, even then, what if, right? People are scared. Dentists are scared. And it's very sad that I get patients pretty regularly who are HIV positive that have been turned away by dental offices still to this day because of their status. So it's important to know, as a dentist, you have the ethical duty to see all patients, no matter, regardless of their HIV status as well. So what if, right? What if you get a needle stick injury? So just like we have PrEP, we also have PEP, post-exposure prophylaxis. And within the first 72 hours of an exposure, this medication will be taken in order to help prevent HIV transmission. And now, even then, I want you to see just how unlikely it is to get an HIV transmission from a needle stick injury, right? Now, first, you have to have an HIV positive patient, and you have to have a HIV negative dental professional. And there has to be something in the way, right? A needle stick. And we think that if we get a needle stick from an HIV positive patient, we instantly have HIV. That's not true. There are a lot of things in between that. Now, first you have ART, or antiretroviral therapy, that the HIV positive patient may be already taking. If they've been taking this medication regularly, they may be undetectable, meaning that there is no HIV virus in their blood. So they're undetectable, there's no virus, how can they transfer that over? Second, we have our PPE, right? That's what we use for all patients. And this is something that also gives us that protection. And then again, if a HIV negative dental professional may be on PrEP. Again, we know that PrEP reduces the risk of HIV transmission at a rate of 99%. Say if the person does not have any of this, right? Say if the HIV positive patient was not taking medication, say that the dental professional was not taking PrEP, what happens then? Well, there's also PEP, like we talked about, that post-exposure prophylaxis. So I want just us to know and realize that it is safe to treat an HIV positive patient, and it is important that we do so without even thinking about it, really. Again, U equals U. Undetectable means untransmittable. So if someone is getting the care that they need, they cannot transmit HIV. If they cannot transmit HIV, that is how we begin to end the epidemic. Again, skipping over a few more things for the sake of time, because I do want to have the opportunity for questions. This is usually about an hour and a half even up to 2 hours presentation that goes a lot into detail of certain medical health conditions and concerns within the community. Good. I do want to talk about monkeypox actually, because this was something that's still relatively new. And we know that monkeypox was a virus from the same family of viruses as the variola viruses, right? The virus that causes smallpox. And the first human case of monkeypox was back in 1970. And for a long time, we did not see an outbreak. We did not see cases until the 2022 outbreak pretty recently, right? Prior to that, monkeypox had been reported in people only in several Central and Western African countries. And so monkeypox can spread through close personal skin-to-skin contacts, like direct contact with a monkeypox rash or scabs, touching objects, fabrics, and surfaces, and contact with respiratory secretions. So with the 2022 outbreak, this is something that's really interesting. And I like to bring up because it reminds us how society still reacts to gay people, still to this day. In October 2022, about a year ago, the World Health Organization reported 75,000 cases and 33 deaths from monkeypox in 109 countries. And you can see an interesting timeline there. And of course, we have a vaccine now that was approved for prevention of smallpox and monkeypox. And it's the primary vaccine that's being used still in the outbreak in the US. Now, this became a queer issue. There is no such thing as a gay disease. However, people consider monkeypox in 2022 as a gay disease. If you watch the news, it was, especially in the beginning, what was being shown? Oh, this was a disease that's only affecting gay men. Perfect, don't have to worry about it, right? What that did was increase the stigma that being gay is bad, having gay sex is bad, and that being gay is dirty and diseased, right? And this is just all too familiar as to what happened during the HIV epidemic, right? And the reason that people were considered it a gay disease is that the outbreak was traced back to 2 raves that were held in May of 2022 in Spain and in Belgium. And these were queer parties. These were queer events, pride events that were attended primarily by queer men. So what happens is at a rave, you're really close to people. So that is how this spread. Now, because this was an international event, a lot of people went back home. Primarily, those that are gay will hang out and spend time with people in their community, and then the monkeypox spread within people of the community. So this was not a sexually transmitted infection, but the media was claiming it to be. Instead, this was just spread through close contact, and that's how it happened. That's why a lot of people, the highest rates of this infection in 2022 were within gay men. So viruses don't discriminate, but people sure do. And again, as a queer issue, homophobic leaders weaponize this disease as a way to depict homosexuality as dirty or all about sex. And then I'm going to kind of skip through this as well. Now with the vaccine, it was kind of interesting because then, it got to a point where as a gay man, I was scared. Working at a gay clinic or in an LGBTQ clinic, I was scared, right? And when the vaccine first came out, again, this was really interesting with, how little actual consideration or work was being done to distribute this vaccine to those who needed it. I myself, I remember being on hold with the health department for hours, and it was really, following text chain threads as to where you can get a vaccine and when, because the wording of the language around the CDC as to who could get the vaccine was only men who have had multiple sex partners in the last 14 days. I did not qualify as that. A lot of my friends did not qualify as that, but I was working with sharp instruments in a population with a lot of queer and gay people, right? So that put me at risk, but I wasn't allowed to get a vaccine because of the language, the way that it was worded. So that means that many people were not able to receive a vaccine or even a test due to not filling the requirements. So, for example, queer people that are in monogamous relationships that maybe still socialize in queer spaces, transgender women who did not identify as a man were not able to get the vaccine. sex workers were not able to get the vaccine, and healthcare workers were not able to get the vaccine. Now, I know kind of getting closer to the end, so how does all this play a role in dentistry? Why is there even a focus? Well, dentistry as a profession still came from a very conservative nature and still can be. In regards to our medical counterparts, dentistry has for a long time been separated and always seen as kind of less important than medical care. And, a lot of research and surveys have shown that patients will do more shopping around for a dentist or a dental office than they do for a medical care provider. So as a provider, we want to show these patients that we are knowledgeable, that we are compassionate, that we're accepting, and that you can come and see us. So this is a study that was recently published just in 2023, I believe. So this is from the CareQuest Institute. And so this survey found that LGBTQ individuals were 77% more likely to experience some sort of discrimination at least once a week. Queer individuals were 31% more likely to say that the recent dental visit was 2 years ago or more. And they were 77% more likely to report that they had visited an emergency department for dental care. So this is all compared to our heterosexual or straight counterparts, right? Queer people were more likely to feel discriminated against in a dental setting, more likely to have a dental emergency as well. Those identifying as queer were 45% more likely to say that they were self-conscious or embarrassed about their teeth or mouth. Over 50% more likely to have levels of anxiety receiving dental care, and almost 60% more likely to say that it would be extremely, very, or moderately difficult to get care from a dentist. Now, the dental profession holds a special place of trust within our society. And by becoming healthcare providers, we've made this ethical commitment to treat everyone with compassion and understanding, regardless of where they come from, what they look like, or who they love. So supporting the queer community gives us a unique opportunity to not only combat health inequalities, but also to save lives along the way. What it means to be transgender. So about 1.5 million transgender adults live in the US today. And one is considered transgender when the sex assigned at birth does not align with that inner sense, that gender identity. We did talk about this already, gender identity versus gender expression. It's important to understand that a transgender identity is not necessarily dependent on physical appearance or medical procedures. Now, many transgender individuals will be prescribed hormones to align their bodies with their identity. Many will undergo surgery, but hormones and surgery are not part of every transgender person's experience. Why? Because hormones, surgery, finding this care, the specific care is hard. And it's very difficult for those in rural places. It's very difficult for those that don't have the finances, the language, the means, or the freedom to be able to do this. And it's also important to understand that someone may be gender nonconforming and may present with aspects of both stereotypical gender identities, such as having a beard and high heels, or maybe even choose to present more androgynously. So transition varies widely and can vary in the appearance, the dress, someone's name, someone's pronouns, and what they want to do in regards to medical transitioning. So you never, the way that someone transitions does not signify, and I'm using quotes here, how transgender they are. That's not a thing, right? Being transgender is a spectrum and varies widely. A person does not need a certain procedure or a certain surgery to validate their gender identity. Treating the trans patient. So there are some oral health concerns as far as having less access to healthcare and being much less likely to have seen a dentist recently or even to see another one in the future. So what does that mean? Maybe if you have a transgender patient that, admits to you that I haven't been to the dentist in 10, 20 years, look really apprehensive, seem apprehensive, may not want to come back. They may say, hey, I just want to get as much as I can done to prevent oral disease, to prevent infection, to prevent pain. Maybe you have to be a little less conservative with your treatment options. Maybe you have to do a little bit more to prevent, certain things from progressing to an infection. And transgender individuals have an increase of risk of STIs, HIV, tobacco use, depression, and anxiety. In 2023, there was a survey from 118 transgender and non-binary people that reported that 33% were misgendered within a dental setting, and 50% of them felt that their dental office was not equipped to provide gender-appropriate care. Now, this is really interesting because there was an ADA study that also just came out, an American Dental Association study that came out this past year, and this was asking dentists how often, I'm sorry, this question first, this questionnaire was asking transgender individuals on how often they're misgendered, how often they're discriminated against, how many times they've had issues with their dentist or dental office. And so it reported that, oftentimes a lot of patients are still misgendered, are addressed incorrectly, or are discriminated against in the healthcare setting. But overall, we're seeing an increase in understanding within the dental professional community, an increase in compassion and knowledge on how to talk to transgender individuals. Good. And then kind of going over, some things to incorporate within our dental practice. Legal name versus correct name. Now, avoid dead naming a transgender person, meaning avoid calling them the name that they had before they transitioned. So in regards to insurance and billing and dealing with minors, it's important that we do have their legal name on file, but we don't have to physically use that name, verbally use that name with them. We can use their correct name. In our patient intake and any electronic forms, can we place their pronouns? Can we ask patients for their pronouns? Can we offer other pronouns other than just he and her? It's okay to ask, and it's okay to use gender neutral pronouns like they, them. So update your intake forms, update your electronic health records to have more gender choices than just male and female. Have a space to not disclose, have a space to include some other, have a non-binary option, and have patients use their correct name and acknowledge that with them with that name. This is a screenshot from an older EMR that I was using at my workplace. And so this would pop up every time, if we had a patient, we had a care alert or some note. And, this note said, for example, please refer to this patient as this, and they use feminine pronouns. Perfect, we got it. That's all we need to know. That's how we're going to refer to this patient from now on. So practice using gender inclusive words like people, person, kid, relative, sibling, right? It's just a good practice to not always have to assume someone's gender. Never assume someone's gender, and it is always okay to ask. Right? There are things that we could ask, and there's things that we don't need to know. Certain surgeries, certain medical transitions, most of the time as a dentist, we don't need to know. If the patient wants to disclose that and have a discussion about that, fantastic. You'll be educated enough to discuss that with them. Now, some trends there's a big lack of research within transgender individuals and their oral health. So this information is more of trends that I have from a transgender endodontist that I know, and that is one of my mentors. Her name is Dr. N. Kopp, and she has experienced a lot of trends in her work. So she's learned that trans men have an increased susceptibility to plaque, to gingivitis, to perio, increased xerostomia, and increased use of tobacco, while trans women, their estrogen and progesterone that they may take may affect TMJ issues and lead to increased plaque sensitivity. So what needs to change? As we're wrapping up here, how do we make these better? Now, this is a screenshot that I took from the ACLU website a few months ago, stating that at the time, there were 321 anti-LGBTQ bills currently in the United States. I just checked a few minutes ago. There are now 501 anti-LGBTQ bills that are active in the US. 501 rules on how to restrict someone's life and how to harm someone's life. And it's just really sad that it seems like we're kind of going in reverse these past few years. Something I like to bring up before we wrap up, I'm in Texas, and I discovered about last year that in our Texas administrative code under the Texas State Board of Dental Examiners, there's a rule There's a rule that if a dentist is infected either with HIV or hepatitis B, each patient must obtain a written consent stating the status of this dentist, right? So, and this is also every time a patient undergoes a procedure. Now, this law is outdated and very discriminatory. Texas is the only state, sadly, to require disclosure to patients of a dentist's HIV and hepatitis B status, meaning that each patient that walks through your door has to be told and has to sign acknowledging that they know that you're HIV positive. Now, this is very discriminatory as this would affect the dentist's career, big time, right? Now, ways to improve. So I apologize if you can hear my dog in the background. We're wrapping up. Ways to improve. So improving as a profession, we need to increase awareness and education amongst dental professionals, such as this DE course that we're doing today. We need to create safe spaces for the career population. And we need to diversify our profession. So just how we have these pipeline programs with the Hispanic Dental Association, with the National Dental Association, how can we include queer youth in these pipeline programs? And finally, I always finish up with 5 steps to becoming a better ally. First and foremost, you want to educate yourself. You want to avoid assumptions. You want to be visible as an ally. And you want to create an inclusive environment. And finally, you don't want to minimize a person's queerness. I'm going to wrap up and give some time for questions. So if anyone has any questions. Thank you all.
Awesome. Thank you so much, Dr. Alex. So we have several folks in the room. We have a few folks on Zoom. Any questions that anyone has? Either you can put those in the chat if you are with us virtually or in the room. Any questions at all? Yeah. I don't know if you were able to hear that question. Okay, so the question was asked in terms of the required disclosure legislation or laws, specific to the one in Texas, since that's the only one that's absolutely required that it be disclosed to patients. Is there any concept of how long that law has been on the books and what efforts have been or are currently in the works to minimize that?
Yeah, I'm not too sure how long that has been in the books. I am, kind of currently working on what can be done, right, to change that within the Texas State Board. So I'm kind of working on currently bringing that up to the board. And it's one of those like rules and laws that people just forget about. The same as how gay men still can't donate blood, right? And it's something that just never really gets talked about, gets forgotten about, and it never gets changed. So as of how long that's been there, no. But hopefully that's one of kind of my big projects for the year, to see how we can start to work with the board to get that changed.
Other questions in the room? Yeah. So our next question is around the work you've done with the Houston Equality Network. And obviously that's a local model, although it's garnered some national acclaim. Have there been any thoughts or pathways to taking that more nationally or repeating that work in other locales at all? And if so, or if not, what do you think it will take to make that happen?
Yeah, thank you. So yes, it's a local organization because when we created it, we felt that's where we could have a bigger impact. I didn't realize at the time how much of a national impact it would have. And so, we've had some interest from dentists and dental professionals in other cities who want to start their own organization similar to us. And I highly encourage it. The queer population is lower, of course, than the general population, especially in a career like dentistry. So the numbers are just not as broad as you need sometimes to start an organization. But the ADA, the American Dental Association, has been very, very supportive of our organization. At SmileCon last year, we had the first ever LGBTQ professional networking social. And so we met people from all over the country, a lot of people that, were just so happy to have this opportunity, have this space. So definitely, if you are in a city and feel like this is something that you can build to have the resources and the community to do so, I would highly encourage it. And I would love to speak to you about that, on how you can get started. I know currently, at least in Texas, there are a couple of people in Austin and as well as Dallas, Texas, who are starting to kind of think of doing the same. So that we can do this in multiple cities. At some point, the goal is to have a giant meetup or some sort of conference within the organizations in the future. So definitely possible. Definitely would encourage it.
There's a lot of activity in the chat, but it seems we have one of our faculty who's a librarian in the chat helping resource folks, which is wonderful. There are folks in the chat asking about different resources, either for our LGBTQIA patients or supporting LGBTQIA plus colleagues and students. So a lot of those resources in the chat available. And I know you mentioned the CareQuest Institute and a couple of other places that have a lot of great resources as well. Are there resources you would wish to share with us at all outside of those?
Yeah, so it's currently, it's the second annual LGBTQ Oral Health Week. It's from October 16th through the 20th, I believe, to today. And if you go ahead and go online and search for the American Institute of Dental Public Health, they are celebrating the LGBTQ Oral Health Care Week. And there's a lot of information, a lot of resources on their website. So the American Institute of Dental Public Health, a lot of great research there. And then I did see a question a little higher up about misgendering, kind of defining what that means. Misgendering is when you call someone the incorrect gender, right? And this may be because of assumption. This may be because someone is not in agreement with how someone decides to express their gender identity or expression. So misgendering would be, for example, I identify as a male. Misgendering would be someone assuming that I was a female.
And I will just add, from my perspective, I know that when we talk about legislation that's happening, sometimes we don't always understand that there can be a direct connection to oral health or oral health workforce issues. I know with some of the work I've done with the DIA, one of the things that is concerning right now is the possibility for legislatures to try to attach issues around gender affirming care to budgetary provisions. And there is one potential bill where they sought to ban gender affirming care at hospitals from a specific funding mechanism. And with that bill, that could be very impactful to GPRs that might be hospital funded or pediatric dental training programs that could be hospital funded. If in that round of appropriations, there is, if that were to pass, it hasn't passed, but if something were like that were to pass, then they basically could pull federal funding from those hospitals that provide gender affirming care, and that could impact any pedo programs that are funded through that mechanism, right? So I know that's not super straightforward, but that is another example where as allies and advocates and folks who have an ethical responsibility, as Dr. Alex has pointed out, to care for all types of patients. I think that's something we should be aware is potentially happening and on the rise, unfortunately. Yeah. Any other questions or comments from anyone in person or with us virtually? This has been awesome. We thank so much for your time.
Of course, yeah. Thank you all for having me. It was a pleasure.
Thank you so much.
I'll put my personal email in the chat, so I'm always happy to answer questions or collaborate with anyone or any organization. So thank you all so much. Have a great weekend.
Thank you for being with us.
Mm-hmm.